Now, at this time, I would like to introduce Dr. Sonia Anand. We've heard her speak. We've been honored by her presence. Perhaps we've had the opportunity to conduct some clinical liaisoning with her. But I'm going to give you a little bit more formal introduction today, Sonia. So Dr. Sonia Anand is a professor of medicine and epidemiology at McMaster University and a senior scientist at the Population Health Research Institute. She is also a vascular medicine specialist at Hamilton Health Sciences and McMaster University. Dr. Anand is the Association Chair of Equity and Diversity in the McMaster Department of Medicine and holds a Canada Research Chair in Ethnic Diversity and Cardiovascular Disease and the Heart and Stroke Foundation of Ontario and Michael G. DeGroot Chair in Population Health Research. Her present research focuses on the environmental and genetic determinants of vascular disease in populations of varying ancestral origin, women, and cardiovascular disease. So, Dr. Anand, it is my honor and my pleasure to introduce you.
Thank you very much, Dr. Hemmons and Dr. Ball for the wonderful session. And I'm not Philomena Tassi. In case you're wondering, where's Philomena Tassi? She is our Minister of Labor, and she unfortunately was called to give testimony at a committee in Ottawa. So she couldn't make it here today. It does mean that we'll end a little earlier, so maybe that's good. And I think I'm really excited by the afternoon. And I'm going to just present a bit of an overview of some of the work we've started here at McMaster within the Department of Medicine, and also coming up with some potential solutions or ways that we can address existing problems. And that hopefully will give a lot of fodder for a great discussion afterwards in Teresa's virtual chat networking room. So Teresa's in charge of my slides, right, Teresa? And I'm going to hand it over to you and I'll get started. Okay, here we go. So thank you. We'll move to the next slide. And I don't have too many disclosures relevant to this talk. Next slide, please. And I just want to start off by reiterating things you probably know, but I like to just put it out there as some evidence for us all to kind of refresh our memories. So women in health sciences are less likely to receive faculty appointments, less likely to obtain leadership positions, less likely to earn a comparable salary, less likely to receive grants, less likely to be first or senior author, especially in top-tier peer-reviewed journals, and more likely to leave the academy prematurely. And you'll see that I cite a number of leading individuals, including Professor Imogene Coe in some of her work. Next slide, please. And what we typically observe in our institutions is this trajectory where women and men start off at the same point, but usually the men end up in the CEO, dean, prime minister situation. And the woman increases in her leadership capacity, but doesn't quite reach the top spot. And if we think about schools of medicine, as being said earlier, only 15% of deans of medical schools in North America are held by women. Now, typically, people would look at this slide and say, well, of course, women chose to come out of the system when they decided to have children. And we're learning all the time that it's not due to choice. Part of it may be the woman's choosing to step back and raise her family, but there are other forces that either repeatedly nudge or push women off of this trajectory. And those are some of the barriers that I'll highlight today. And so within our Department of Medicine, back in 2017, we took a look at some of our data. And here's some data from the full professors in our department. And first off, you'll see on the far left that women full professors on average earned $27,000 less in terms of their base salary. And a base salary is only one component of a faculty member's salary. This was the component we had access to. So we saw this differential. Then when we looked at leadership positions, you could see the majority of the leadership positions, such as department chair, associate chair, division directors, were held by men. And then the intriguing part was when we looked at the educational hours and research points accrued by gender, we could see that women were putting in more educational hours and accruing more points for their research work than men, which seems quite paradoxical. One would expect the hours put in, the research points gained, the value of a faculty member would be reflected in the base salaries and in leadership, but we didn't see it. So this could be thought of as partly a paradox. Now, there are some limitations to these data. Base salaries reflect one component, and these hours and points are self-reported. But it did show us that there was an apparent trend and discrepancy. So we took these data to a group of women faculty members across all ranks, and we discussed them almost like in a qualitative methodology. And we came up with 5 action items. The first was to create a formal chair, the Associate Chair of Equity and Diversity, which I currently hold. The second was, some of these things sound basic, but they weren't in place, to bring about equity and transparency for base salaries and stipends. Number 3, to bring transparency to new leadership opportunities. So rather than just anoint or appoint the next leader, to advertise that a leadership opportunity was coming up, to have clear terms of reference, and to tap women on the shoulder to apply. And because in our department, 30% of our faculty members are women, we advocate for at least 30% of people around the table on selection committees being made up of women. The fourth point was limiting terms for leadership roles. So this is clearly being shown in the literature that the longer an individual holds a position such as division director, department chair, vice dean, the more that plugs up the pipeline for other people who want to progress and step forward in leadership. So it's quite normal to have a 2-term leadership position, which could be 2 5-year terms. It's not as normal to go on to 15 or 20 years in the same leadership position. And the 5th point was to set targets. If our department is made up 30% of women, we should start to see more women getting into leadership. So setting targets is a way to move this system faster. And we can talk about that more in question period. So with these action items, you may ask, well, what type of approach is this? And really, many of those action items are bringing about what is referred to as a quality of opportunity. So we're just making the possibility of achieving those top spots equal by making things merit-based and being part of the decision on what those points of merit are, to create a transparent system, making the most meritorious candidates reaching the highest positions, as opposed to it being based on who you know or who you've impressed. And as I mentioned, to make change faster, we should set targets to get people into positions. And I often hear as a response, well, don't you think this should be based on merit? That is non-negotiable. We're not saying bring someone who's not qualified into a position. We're just saying, let's be part of the discussion on the merit system. And we know we have enough well-qualified women to be in these positions. And in the case of our department, we have no Indigenous faculty members, and we don't have any full-time Black faculty members. So in this case, we really need a more aggressive strategy, an equity strategy, to increase our faculty members from these groups and to make up for missed and lost opportunities. Now, you may have had this discussion earlier this afternoon, that around the tables that we sit, sometimes on selection committees, you will hear and observe, number one, ambiguous assessment criteria. Like, okay, we're here to choose a leader. Like, who do you think would be a good fit? That is ambiguous. And you'll hear comments such as, the candidate's not really the right fit, or I don't really like their communication style. A common one is they're not ready for such a role. And then we've all probably heard, I don't know how she could handle this new position, having 3 kids and all. So these are what we would see as potentially unconscious biases or poorly thought out remarks. And they should be red flags for us when we sit around the table. We go to the next slide. Many of these comments made at the table do reflect what we call unconscious biases. And I'm sure you've all heard of these. These are the first thoughts that come to mind, that thinking fast pathway that people just say at the time. Now, we know we all harbor these biases. We're strongly influenced by our upbringings and the circles in which we travel. We can test and quantify our types and degree of bias using something like the implicit bias test put forth by Harvard University. And so these are, there are ways we can test our biases by doing this implicit test through Harvard University. We can determine the type and quantify the magnitude of our biases. And every single equity strategy would have as part of it a unconscious bias training. But anyhow, this is the Equity Checklist 2.0 in the Department of Medicine. And you'll see we've just standardized our approach to selection committees, but we do have standardized questions. We have a quantitative score and blinded voting, with the majority vote winning. One of my colleagues, Dr. Will Harper, came up with a great idea, and we had many discussions about minimizing bias. And he's of the firm belief that we can't really minimize bias through proportional representation of women and unconscious bias training. So his innovation, and I always make a strong plug for inequity and diversity initiatives, his innovation was to say, usually what we do is we select candidates based on a majority vote. So 51% versus 49%, the candidate would win at 51%. But where we have to have a majority of people endorse the candidate, say to a level of 70%. And then we're more sure that we've selected the better candidate. And in order to minimize groupthink and bias, we'll make the committee as diverse as possible. And we'll diversify on gender, on ethnicity, on geography, on rank. And the more diverse we make the committee, the lower we could bring our certainty threshold down. If in the presence of maximal information, we still declare we can't know who's better, we flip a coin and we randomize. So this is a strategy that we've tried in the Department of Medicine now 4 times, and we've written up this paper for future publication. So that's an example of an innovation. Another example of a structural change is something I mentioned in one of the working groups. And some of our colleagues from Toronto have done a randomized experiment actually showing that rather than saying leaning in, why not put everybody in and ask people to opt out? And what they have shown is when we do this in terms of tenure and promotion, division directorship, or other leadership selections, that putting everyone in and actually asking people to opt out does improve the gender balance in these positions. So this is another strategy to consider. Now, I described our department checklist. I could say, well, we've got the checklist, our job's done. But there's a limitation to checklists. It's one part of an equity approach. but it can't do it alone. Now, what do I mean by that? Let's go to the next slide. Together with checklists and a strategy, we could go to the next slide, please. We also need to have a culture and climate shift. So we can't have a standalone checklist if the leadership in an organization or the constituents of an organization don't fully embrace the importance and need for this change. So we need a checklist, but we need that together with a change in climate and culture. Only then would we have the potential to be successful in bringing about equity for women or for racialized people. So this is an interesting book written after the 2008 financial crisis, where they show that had there been more women around the table in Wall Street, we may not have suffered the 2008 financial crisis, really built around those subprime mortgages. And so what the belief is that if Lehman Brothers had been Lehman Sisters may have made less money during the boom time, but probably would still be around today. Because as you know, Lehman Brothers went bankrupt and crashed along with the 2008 financial crisis. And so that diversity of thinking, perhaps having more cautious voices around a table, actually improves the bottom line in businesses. It's harder to quantify in academia, but likely that's the case in academia too. We could go to the next slide. I actually have a little video clip that highlights women in leadership, a humorous one.
Hello, greetings and welcome. Thank you so much for coming today. This is our first World Summit since the revolution, where we ascended to power, replacing our male counterparts. It's been a busy few years, yeah?
To say the least.
What's on the agenda?
Yes, first of all, the economy.
Well, actually, everything's great here. Yep, us too.
We're cool.
Us too. Same here, Jill.
Yep, all good here, no problems.
Great. Okay, environment. Is anyone having any environmental problems? Anyone?
No. No.
No.
No.
No.
None.
Ditto.
And what about conflict, social justice, any war, any hardship, conflict in their continents?
No, we just talk it out these days.
Yeah, we find it's very helpful to write things down and then sleep on it, see if we feel the same way the next day.
That's a great idea. Yeah, us too. There was some conflict with my California and Jill's old South America, and then we just realized we were angry at ourselves, weren't we?
I mean, I was projecting all my shit onto this one. And then I realized it was just my stuff onto her. So I'm so happy that we're cool now.
Yes, very cool.
Well, I think that's it, ladies. Everything seems to be in order. Yeah.
Okay.
I can't believe that this summit used to take days. Anyone want to grab some wings?
Just a little example of why diversification and different people around the table can make things different and sometimes better. So how do we go about diversifying an institution? Well, what we know is what doesn't work is the checklist without the culture change, a focus only on unconscious bias training, force feeding certain solutions actually can make people and faculty member defensive and more resistant to change. Oftentimes, division directors or managers may not feel engaged in the change, and it becomes this shame and blame culture. So that hasn't been that successful. What has been more successful, and again, most of the examples coming from the business world, is if you want to diversify and take this very seriously, we need the highest levels of leadership to endorse it. So a dean or CEO creating an EDI task force, for example, and sitting on it and attending the meetings and making sure people are accountable back to the top leader. To engage their faculty and membership to help solve the problem. So invite everybody's ideas. You tap into people's desire to do good, but also to look good because people want to look good. Mentoring and sponsoring, a key part of this. In particular, this has been effective in the business world, bringing African American members into leadership positions. This was very effective in Coca-Cola, for example, and increasing the top leaders and division directors, department chair, together with visible minorities. And a great example of what worked is in Deloitte, whereas in 1992, they had an exodus of women from Deloitte. And then the CEO took it seriously, created the task force, sat on it, and turned it around. And in 2015, Deloitte had their first woman CEO leading the charge. So if we just click on, yes, diversity and inclusion needs to be an ethos. So that's getting at the culture that permeates the entire institution, championed not only by an EDI chair or human resources department, but by everyone, and especially the senior leadership. So the importance of it is clear. Only then will a program be successful. So what is this? This is a brick wall. And sometimes when you pick up an EDI book, this is a second page saying, this is your job description, because you're often going to hit some brick walls and some resistance to change. If we go to the next slide, I would just like to highlight that recently we've all probably reflected on the headline in the newspaper, which was Hamilton Health Sciences discriminated against a female cardiac leader. And this was the decision of the Human Rights Tribunal of Ontario. And not knowing all the details and not getting into those details, when we ask the question, do we have gender discrimination in our workplace? The Human Rights Tribunal answered yes. And what I would like us to do is learn from this case, like we do M&M rounds in medicine, so that we can put things in place to prevent the worst possible outcome. And this is an example of the worst possible outcome. In our Department of Medicine, we do every 2 years a survey. And we ask the question about faculty members experiencing unprofessionalism. And you can see in 2019 and 2021, 40% of our faculty in the Department of Medicine reported experiencing unprofessionalism. That percent didn't change. In 2019, we were surprised to see that 30% of our faculty were not aware that there were policies to address unprofessionalism. So we made a concerted effort to get those policies out. And we did see in 2021 that a greater proportion of individuals were aware of our policies. Now, if we look at what types of unprofessionalism were observed and experienced, the majority were reports of disrespect, and a lower percentage, but a real percentage, included abuse, harassment, discrimination. And we did see abuse and harassment reports go down between 2019 and 2021, but we saw discrimination go slightly up. So, we're getting better, but we still have a lot of work to do. Now, when we looked at intersectionality, when we broke it down and said, who are these faculty members? We can compare women to men, but we can also compare non-white women to non-white men and really get a sense of who is experiencing or witnessing unprofessionalism. And it's a complicated slide, but you can look at how we've structured it, and where you see the apex of the black line, there's a greater proportion of that group reporting this experience. And for unprofessionalism, we see the burden is carried by women, in particular non-white women. When we look at the response to being denied opportunities solely based on gender, ethnicity, or race, again, it's women and non-white women who report this the most. And being subjected to offensive remarks or names we can see, again, women and non-white women carrying the brunt of this experience. So that's where the intersectional piece is important when we're developing strategies. So here we have this, what I put together in terms of the issue of harassment and discrimination. Could we view it as a preventable disease like we do acute myocardial infarction? So in the top two rows, you'll see an acute MI pathway that has been developed and it's in place and it works. Example is, we know time is muscle. When the patient gets into the ambulance, the hospital is made aware. In the olden days, it was right to thrombolysis, but in the modern day, we have to prepare the cath lab to be ready to take that patient right in for an angiography and PCI. And what are we trying to prevent? We're trying to prevent myocardial damage and death. And this type of clinical pathway has been extremely successful. So what if we thought, in comparison, our harassment and discrimination policies? What happens there? Well, when and if it's reported, we do have a policy like a clinical pathway, but there are many uncertainties. Sometimes the policy is unclear. Sometimes the individuals advised not to report it. And what happens? We have unsatisfactory outcomes. Women can leave, or other faculty members who've reported discrimination could leave the institution. They could become apathetic, saying nothing will change. They could be cynical. They could change their career completely, sideline or silence. So what we have in place now is not optimal. So why do unprofessionalism policies fall short? You may hear people say, you know, when individuals approach us and say, I've had this bad experience, should I report it? Often the response is, just take the temperature of your environment and you'll realize, you know, how hard an uphill battle it might be. If it's going to be too hard, maybe you shouldn't say anything. And so these are always the calculus women are making. And I've had a student who's come to me and said, if I report this, do you think it will affect my career in the future? And I look at the situation and say, quite honestly, it might. And the decision has to be up to the individual. And most individuals will choose not to report because of that. And when we look at the current state, it's a lose-lose situation. The woman is typically faced with either reporting harassment and suffering those consequences or not reporting it. So the case that I referred to in the Hamilton Spectator represents a rarity, because only 1 in 10 women report the case, and only 1 in 100 are found to be the winners in a case. But in reality, it's lose-lose, both for the hospital and institution through loss of a faculty member and a huge amount of money and a lot of derision within the faculty, and a lose for the person who's had to struggle for 5 or 10 years to make their case. So what can we do if the current policies are not the perfect clinical pathway? Are there alternatives? And I think that there are many alternatives and we should be using them more. So at the beginning of a conflict and the red circle showing the worst possible outcome, what could we do? Well, beyond a policy and referring someone to human resources, we should consider mediation, coaching, team intervention, and adopt some novel strategies that are evidence-based, such as bystander policies. And if we go to the next slide, a bystander policy really is trying to get around a structural bias, right? So this is an example from the great book by Iris Bonet, What Works. It shows that just trying to change people's mindset about a situation probably won't work. So the principal violinists here were found always to be men. And so they put a curtain in there. And when people played their music, it was based on the sound that the decision for the principal violinist was made, not based on gender. So if we go to the next slide, we'll show an example of a structural change that could reduce or address some of these harassment complaints that come forward. And a bystander intervention involves training individuals who, when they see a conflict starting, can intervene and prevent it from becoming a bigger conflict or growing. And this has been used successfully in the military and across college campuses in the United States. So this is an example of a structural intervention that could prevent that pathway from a complaint to the worst possible outcome. Next slide, please. Another effective strategy appears to be what's called the Ombuds Office, and MIT, the academic institution in Boston, has used this very successfully. So it helps resolve the complaints of harassment or discrimination, and it tracks the complaints. It's able to keep the complaints confidential in a way that the current reporting through human resources does not. And there's even an interesting new Silicon Valley creation called techquitable.com, where you can go online and get this virtual ombuds office working for you. And what the ombuds office can do is identify hotspots in an organization, feed that back in a confidential way to the leadership and say, you should look at this division, there's some problems brewing. And that could be a preventive strategy rather than the worst possible outcome. So if we go to the next slide, a quick clip from MIT on their ombuds office.
The Ombuds Office is a confidential and independent resource for everyone in our community to constructively manage concerns and conflicts related to your experience at MIT. As a large community with members that come from different backgrounds and approaches to their work environment, we expect and even embrace some conflict, but we often need guidance on how to approach and work through some of these differences. Don't know what to do or who to talk to about an issue or a question? The Ombuds Office is a good place to start. Visitors come to us with a wide range of questions and concerns. Some include conflict with a supervisor, advisor, PI, colleague, or peer, conflict within a department, lab, or center, department or organizational change, academic integrity, career progression, and many others. When a challenging situation presents itself, we can help you in several ways. We offer communication coaching, option exploration, shuttle diplomacy and informal mediation, policy clarification and referrals, and facilitated group discussions or workshops. We can listen, explore, coach, and offer referrals, but you decide if and how to proceed. Interactions with the Ombuds Office are completely confidential, so nobody will know you have consulted with us unless you choose to disclose it. No records are maintained, and raising concerns with us doesn't initiate any formal action or process. You own the problem and the solution. For more information, please visit our website, or you can call or email to schedule.
And that's an example of an effective structural change. And so when we come back to this clinical pathway and then think about how we could apply structural change to advance equity in leadership positions and awards, for example, the two examples I've given today include the game theory approach to selection committees and the opt-out procedure for award selection and other nominations. And this would likely lead to greater equality of opportunity and diversification of our leaders, and through that, a positive culture shift. With harassment and discrimination, the new structural change could be something like bystander training, the Ombuds Office, as well as the Silicon Valley Techquity type approach. The complaints could be made and addressed, and hopefully in a satisfactory manner, such that we avoid the worst possible outcome. Just like in medicine, we can't always prevent death, but we can greatly reduce it through prevention strategies. These are two areas in equity that we should move into in order to optimize our outcomes. So why diversity matters? In the business world, it improves the bottom line, where the profits are easy to measure, and that can clearly be shown. Within academia and other organizations, diversity around the table, be it by gender, race, and other characteristics can ensure a breadth of perspectives are presented and a breadth of solutions can be made. It also prevents the worst case scenario. In our outcomes, the worst case scenarios are outcomes where faculty members leave. And if we diversify, we're less likely to get into the trap of groupthink where we think we're right and the other person's clearly wrong. So to wrap up, I would just reiterate some of the components of today's afternoon that you've likely heard. That in order to diversify and create a more equitable environment, we need to change institutional norms. The fastest way to do that is to change the normative approaches of the group leader. So diversifying the group leader has a very rapid effect on changing culture and institutional norms. Accountability and transparency are critical. In our environment, that's around salary and leadership selections. We find, and we're often asked the question, well, you're just talking about gender. What about the other equity-seeking groups? They're really important. And again, you have to know your environment. You have to measure, what the issues are and then, move forward. But often you have to pick one. And the data would suggest that, with respect to taking gender on first, once you've improved the accountability and transparency around gender, that things in general improve for other equity-seeking groups because you've opened up those two key points, transparency and accountability. A change in climate and culture requires a very serious commitment from the leadership team. So it's easy to say we're all in for EDI. It's, risky because it could backfire if you haven't brought with that EDI office, officer, or checklist climate and cultural change. And we want to, the end game is to create a culture where people feel personally responsible for the change, but still maintain their autonomy. And we've learned today about sponsorship and allyship and how important that is. And equity isn't the same old thing and the same for every institution. So treat equity and diversity initiatives as innovation challenges with some of those neat structural changes that have been designed and evaluated. And if they work, they should be implemented. And by creating organizational accountability, what gets measured gets done. We learn from our mistakes and we're continually trying to optimize things. So if I go to the next slide, which is one I just threw in because many of us are doctors, that there's a nice study showing that just by virtue of being a female doctor, you inspire your young girl patients to choose a career in STEM just by being you. So that's really interesting and a nice finding from a study in Norway. And finally, I would just like to thank all of the people that have helped me in this journey and also putting on this day. You'll see Dr. Smita Halder, Claire Mitchell, Teresa Chan, Dr. Sharon Ball, and underneath there, you'll see the large equity and diversity advisory committee we have in the Department of Medicine. So for some people, I couldn't find your picture, so I apologize, but really know that when you take on an equity and diversity initiative, there are many people who will be interested in supporting you, and that support is crucial.